In this video, we'll look at how to use Turnitin to improve writing about sources. We will look at how to interpret your text similarity results, how to identify how you have to use sources, and how to evaluate and revise your approach to using sources. In this video, we assume that you already know what Turnitin is, but if you want to refresh your memory, have a look at the Monash University Library Turnitin Guide. Just type in the words Monash University Library Turnitin Guide into your browser, and you will find this page that introduces you to what the program is and some of the basic applications. Let us set up our scenario. Let's pretend that you have an assignment. You put it onto Turnitin, and as you look at the results, it's looking very bad. Your similarity score is quite high, and as you're browsing through the document, you're finding a lot of highlight, like in the example here. What this means is that there are three places in this particular paragraph where you have either copied the original text word for word, or your rewording is so close to the original that it looks like you're pretty much copying from the source. So let's have a look at it step by step. And let's interpret what those results actually mean. Assessment serves as a basis for deriving accurate nursing diagnoses, for planning and implementing both initial and ongoing individualized care, and for evaluating care. We have a reference there, but it does look like we use this definition pretty much from the original source without rewording whatsoever. Health assessment involves a primary assessment, secondary assessment, and a focused assessment, which revolves around the patient's chief complaint. Now, this sentence looks like it does not use any sources at all. This is your writing. This clinical case study is centered on a person who has presented to the emergency department with increasing fatigue, shortness of breath, substernal chest pain radiating to his jaw, and nausea. Now, this looks like it's borrowed from somewhere. We don't know where from. Upon primary assessment of this person, the nurse executes the following interventions: oxygen therapy, electrocardiogram, pain and nausea relief, NAMET call. Upon secondary assessment, the nurse implements further interventions such as lower leg elevation and dietitian and social worker referrals and a doctor's review. The second part also looks like it's written entirely by you, and this is followed by the last sentence of the paragraph. Failure to identify that a person is deteriorating can have serious consequences, and the structured approach to assessment reduces the risk that signs or symptoms of illness are missed. And this last sentence looks like it's taken pretty much word for word from a source. Because you wrote the article, you can actually identify the sources. You know that the first sentence is taken word for word from an article by Lamont. You actually know that he used the same article for the last sentence in the paragraph as well, where you thought it was a pretty decent sentence, and you entered the whole thing in there with a reference at the end. The middle part of the paragraph is taken directly from the instructions of the assignment, and you thought you wanted to be careful and have the wording there. One way to acknowledge the sources properly would be to simply quote them, and this way we would end up with three large quotations, one starting with assessment serves, another one with Mr. X who has presented, and the last one with failure to identify that. But if you look at the paragraph, it's probably obvious these three quotations would pretty much take half the space of the paragraph, leaving very little for you to express your own opinion. So this is probably not the best strategy. Nor would the best strategy be to paraphrase everything, because this way you would simply rewrite slightly chunks of text that are there and fit them into your paragraph. So let's have a look at a better way of dealing with sources and using them in your writing. That means to identify how we have used the sources. The first thing we should do is ask ourselves what role each source is playing, or what is its purpose. The first quotation here is a definition. It's a definition of assessment. The second one gets us the context for the case study. And the third one looks at the implications of failure to identify. The second question we should be asking ourselves is whether each source is best suited for its purpose. Is the article by Lamont the best way to define what assessment is? Is the article by Lamont also the best source to tell us what the implications of failure to identify are? The second source, the description of our case study, has to be there. The question there is not so much about the quality of the source, but about how we are using it. Now that we know that the sources that we're using are the best ones for this assignment, let us have a look at how we can revise what we have written. When it comes to definitions, it's very important to know whether we have to keep the wording of the original definition or not. Usually you have to keep the wording of the original definition if it's a very, very strict description that's used, applied in a field, or if it's an accepted way of defining a term that you want to preserve. In this case, just quote it. But if you can describe the definition or a term in your own words, or if you can paraphrase the original, you can do so, and it's going to make your writing more smooth and feel more like it's your own. So let's have a look at this definition. What we have here is several important terms: assessment, accurate diagnosis, planning and implementing, initial and ongoing, and evaluation. Is there a way we could write this in our own words? And there probably is. This is one way of doing it. Assessment is an essential part of nursing practice. It guides all stages of patient care, including deriving a diagnosis, planning and implementation, as well as evaluation of care. If you compare this new description of what assessment is with the original, it does capture all the major terms, but it's written in your own words, and you can actually use it as a piece of your own writing, provided that you put reference to Lemon in the end. The second passage from Lemon is not a definition. It's an observation from the article. If we have decided that Lemon is the best source for this, and this is an important thing to think about, then let's use it. But we're not going to be quoting it because it's not necessary. How do we capture the main terms? Well, let's just focus on the main ideas that are in this passage. We have structured approach, we have failure, we have ability to identify. Can we write this? I think you can easily do this on your own. And the easiest way to do this would be just to write a very simple statement. Structured approach reduces failure to identify symptoms, and then you can play with it and see what's the best way to write it. At this point, you probably have a pretty good idea as to what to do about the middle source, the description of the case study. Sure, you have to use a lot of information from the original instructions, but do you really need to copy the entire sentence? Have a look at the description, identify the major keywords, build a story around the case study, see how you could write about it, and do it. And of course, use a reference if necessary. By now, you should have a pretty good idea about how to interpret text similarity results from Turnitin, how to identify, how you have used sources, and how to evaluate and revise your approach to sources. And when you use sources, just ask yourself these questions. First of all, what are you actually trying to say? What is your main point? That's going to help you frame the paragraph and see how you're using the sources. You can ask yourself, am I using this source to define something? Am I using it to summarize or to illustrate something? The second question to ask yourself is whether the sources you're using are best for the purpose. Is this the best source for defining something? Is this the best kind of illustration? Is there a better article I can use for this particular purpose? Third question, what are the essential terms I need to mention so that I do not have to quote fully, but can use responsibly a source in my own words? Then, how can I write this in my own words? And only quote when the wording is absolutely essential, and of course, reference the source as necessary.